Hey, it's Jerome, and I'm going to talk to you about PTSD. So, what is PTSD? PTSD is an acronym for post-traumatic stress disorder. The words kind of speak for themselves. The stress and serious anxiety that come post or after a traumatic event. The event either seriously harmed or threatened a person's life. This is how your body deals with the traumatic event. On the Veterans Affairs website, it perfectly describes it as a normal reaction to an abnormal event. Signs and symptoms usually appear within 3 months of the event, although it may not appear for years. Symptoms include re-experiencing the event, nightmares, unable to feel pleasure or happiness, worrying, easily being angered, dizziness, fast heartbeat, shortness of breath, intense reoccurring unwanted problematic memories about the traumatic event that might come back to you, negative emotional responses that remind you of the event, a feeling of numbness, irritability, and feelings of devastation. Relationships will get noticeably more difficult with PTSD. It will be hard to socialize and get along with family, friends, and coworkers due to bad sleeping patterns, alcohol use, and just a feeling of emotional numbness. Okay, you're sitting there and you're wondering, okay, Jerome, I understand all that, but what causes PTSD? What events cause post-traumatic stress disorder? Alright, so what can cause PTSD? Car crashes, fires, bombings, rape, torture, seeing a family member, friend, or other person get harmed or killed. Many people experience a traumatic event but don't even develop PTSD. You have an even higher chance of developing PTSD if you have a history of mental illness, no social support after the event, have stress coinciding with the event like death of a family member, or even guilt and shame about your role in what happened. However, it lowers if you have support from your family, friends, and support groups, and learn from what happened, even how you acted, responding well to fear. The good news is that PTSD is recoverable. Some take 6 months, others take years. It differs from person to person. One-on-one counseling and therapy sessions help. Family counseling for relationship strain, medication for your depression, nervousness, and sleep problems, but usually a combination of therapy and medication together work best. Left untreated, post-traumatic stress disorder can lead to alcohol and drug addictions, a heavy fear of death, chronic pain, hypertension, and self-injury. Also increased suicidal thoughts, so it's best to get treatment. If you know someone suffering from PTSD, they should immediately visit their local doctor. I'm going to leave you with a quote from Ute Lawrence. Trauma can be a vital part of your life, just like stones can support and strengthen the root of a structure of a tree. Like a tree, you are resilient. With patience and support, your roots can be restored and your branches can spread again.